Imagine going through life not being certain if what you see, hear, believe, sometimes even smell is real or whether it's something that's created by your brain because you have schizophrenia. It is not as uncommon as you might think, but there's a lot we don't know and don't understand about schizophrenia. So that's what we're going to focus on today. I'm Lee Kelso, host of the Health Call Radio Hour, the place here where you get extended versions of interviews heard in our weekly radio broadcast, now heard nationally on radio stations around the country. Let's learn a little bit more about schizophrenia by talking to someone who specializes in treating patients with schizophrenia. She is Dr. Lisa Cowley. She is a clinical psychologist who has a practice focusing on treating people with schizophrenia in the St. Paul, Minneapolis area. Lisa, thanks for being here. Tell me something about schizophrenia many people believe, but really isn't true.
Many people believe that having a diagnosis of schizophrenia will automatically mean you're going to be violent, and that is not true at all. I have been in practice for 22 years and have never been physically threatened by a person with schizophrenia.
That's good to hear. So what we see, what Hollywood has trained us about schizophrenia really isn't at all the fact, huh?
Correct. There are a few movies that have accuracies, but there's so many that don't. Silence
Yeah.
of the Lambs is a terrible example.
Oh, good to know. So give me an idea of what is common to schizophrenics. What do they all sort of experience?
Well, you can't say that all experience X, Y, or Z, but most of them will experience hearing voices, some of them seeing visions or smelling or feeling things that aren't there. Many of them have delusional thinking, which is a false idea that seems very real to that person at the time, such as paranoia, or they might believe that the government has put mind control chemicals in their carpet. And to them, it
Hmm.
absolutely feels real and it's very terrifying.
And you can't talk them out of it. They're just absolutely convinced.
Nope, that's a medication issue. Yeah, I cannot talk them out of it.
Wow. Okay, let's go back to hearing voices. What does that mean? Are people talking to me? Give me an idea of what that experience is.
Yes, there have been some research studies with MRIs that show that hearing voices is the exact same neurological mechanism as actually hearing a sound from outside your head into your ear. So it
Hmm.
sounds exactly like someone is talking to you from outside yourself.
And are they directing me? Are they criticizing me? What's the message that I might receive?
Usually they're fairly mean, criticizing people, criticizing the client a lot. Sometimes they do command them, like go brush your hair or move that pencil over there. Or sometimes even you should harm someone or harm yourself. My clients who are on medications and following their treatment plans are generally able to resist those commands. So it's just one of the coping skills we work on.
I watched a video with a patient who said sometimes it's just a narration of everything that's happening around me. Okay, now there's a blue car driving down the street and he's going to turn right, or things that I'm
Yes.
doing, a narration of things that I'm doing. That's common.
That can also happen. That's, more on the lines of annoying, whereas some of the voices are scary or just, make the person feel bad. But yes, sometimes it's just a running monologue of what the person is doing.
Is it ever supportive or is it always negative and threatening?
In the United States, voices are rarely supportive. In other countries where mental illness is viewed differently, sometimes voices are supportive.
Well, that's interesting. Huh.
Hmm.
W-
I'm not sure exactly why, but it seems maybe because there's such a stigma here against mental illness, whereas in some countries, like third world countries, people are used to illness being more real and not necessarily being able to be completely cured. So it's just like, well, yeah, it's your grandfather telling you what to do, and he's got good advice.
Huh, that's fascinating. I had no idea. Tell me about
Hmm.
the visual hallucinations. What can those be?
It could be a wide variety of things. It can be seeing flashing lights. It can be seeing things out of the corner of your eye, seeing shadows. It can be actually seeing like figures, like a demon or a person.
Hmm.
Yeah, it varies widely. I,
Yeah, that's
yeah.
frightening. And then, are these things that come and go? Is it something, is there a pattern that typically is stress induced, or is it just I live with it all the time and have to figure out a way to cope?
That depends a lot. If the person is not on medications, they tend to be very, very frequent. If the person is on antipsychotic medications, they tend to be less frequent and less intense. Most people that take antipsychotic medications do not, the medications do not completely eliminate their symptoms, but they make the symptoms, like I said, less frequent, less intense, and easier to manage. They
And then
also help people understand that they have a disorder.
okay, good. So there's some grasp on reality is returned at least. Yeah, okay. And then I understand there can also be physical and even sensory hallucinations, like I'm smelling things or feeling insects crawling on me. It's just
Yeah.
what a bizarre disease. Do we know why this is happening? Is there something organically different in the brain?
Well, they know that there are some differences in like the structures of the brain. They have these little vesicles that are bigger in people with schizophrenia. They know there's some roles in neurochemistry, so that's why medications work. There's also some evidence that an injury to the brain in utero or as a very young child can increase the risk of schizophrenia.
Hmm.
Plus, it's also genetic. It tends to run in families, but it doesn't always.
Yeah, yeah. And I read there's a viral connection potentially. So having exposure to a virus in utero or as an infant, that can also be a increase the risk. Um,
Yes, that's part of what I was referring to, but of brain injury. But you're right. There's a virus, but we don't know which one.
okay. And no cure, right? There's nothing that's going to fix this problem permanently.
No, I like to think of it like type 1 or juvenile diabetes. If you take your medicine and you follow your treatment plan, life can be pretty good. If you
Oh.
don't, life will go downhill quickly.
Yeah, I was going to ask. Give me an idea of what life is like for somebody who is successfully medicated and has had successful therapy.
So they would have the vast majority of people, even on medications who are stable, do not work full time. The illness just does not allow them. The stress is too much and it makes their symptoms come back or get worse. Many of them work part time. Many of them, are somewhat isolated but have a few friends. They do things that anybody else would do, like, oh, I love making lattes. I want to go on a hike or watch the football
Hmm.
game, but their lives tend to be a little bit smaller because they have less, like that spoons theory about endurance for stressors. They have less of that. They can't handle three activities in one day. It's too much. So they just have less going on in their lives, and that's easier for them.
Got it. And so they are capable of living alone independently, or do many people wind up in a supervised setting?
I would say it's about half and half. Some live independently, some live in a group home or adult foster care or something like that.
Is there any relationship to a family structure? Is violence in the family more likely? Is sexual abuse an issue? What give me some idea of how those whether something conditionally about the way that child was raised has any influence.
There has not been evidence showing that parenting styles can cause schizophrenia. If you have a genetic loading for schizophrenia and you have a very stressful experience, especially in teens, it can bring it out, but it was probably already going to be coming out at some point anyway. But abuse does not cause schizophrenia. Trauma does not cause schizophrenia. It's more about the genetics and the viral thing in utero and that kind of thing. So it's not caused by people's parenting.
When I think people often see someone, a street person, a homeless person who might be obviously having a conversation or an argument with nobody there. That's kind of my perception of schizophrenia. Is that on target, off target? Am I set me
Well,
straight on that?
I would say that the person that you see on the street talking to their voices is likely unmedicated. They may be intoxicated. Um, a lot of people who are unmedicated tend to hide. They don't, the world is scary for them. Their symptoms are scary for them. They'd rather sit at home in their room with the blinds drawn than go out and about in the world.
Hmm.
Can someone with schizophrenia be on the streets talking to voices? Yes, but it's not common. And when they're, unless they're intoxicated. And then when they're stable and on meds, we talk in my groups about like, you're allowed to talk to your voices, but there will be social consequences. And if you don't want people being really uncomfortable around you, you might want to try not to do that.
Oh, tell me more about that. So, talk to your voices. You encourage people to have conversation with that voice. What am I saying?
No, I'm saying I encourage them not to talk to their voices in public
In
just
public.
because of the social consequences. But if it makes them feel better to talk to their voices when they're at home alone, there's no harm being done. So, I don't see why not.
Okay, so is that a strategy to talk to the voice and say, I know you're not real, or I don't want to hear that right now, or some other coping mechanism?
Yes, for some people, that will diminish their voices. For some people, it will make it worse. So people have to experiment with the coping skills that work best with their illness.
Wow, what a learning process. It just sounds like it would be exhausting.
Yeah, the groups I run are once a week for usually at least 6 months, sometimes a few years.
And patients, you said, are typically not violent. I have read that more often than not, these folks are the victims of violence and are being taken advantage of.
Absolutely. Number one, sometimes they have a demeanor of someone who's not very assertive. And so, you know, criminals or that kind of person will zone in on their vulnerability. Also, many people with schizophrenia are very generous and have big hearts and get taken advantage that way, like
Hmm.
financially exploited.
Yeah, I suppose that is going to happen, right? So there's a
Mhm.
concept of positive and negative symptoms. And it's not that those are good or bad. We're really talking about symptoms that take away from life and symptoms that contribute new sort of aspects or features. So let's walk through those. What's a negative symptom and what's that really mean?
A negative symptom is something that's harder for a person with schizophrenia to do that's easy for a typical functioning person. So this might be organizing your thinking or organizing your life or getting up and getting things started or following through or tolerating a lot of noise, lights, people. So it might be these people just have a harder time with that thing. Also, they struggle with eye contact. They struggle with their faces showing the emotions they're having. Often their faces are still. Those are all examples of negative symptoms.
Oh, yes, I've read of the mask. So you just kind of have this blank expression all the time. You don't really display emotion in any way. It's not a, and it's from my what I've read at least. It's not something I'm doing intentionally. It's just I am not emoting.
Right. They're not doing it intentionally. I'll have clients in my group occasionally who just are sitting here, same look on their face. And at the end of group, and I say, okay, group is over, they're like, wow, thank you. That was very informative. Like they were using all their energy just to listen.
Hmm. Wow. And
Yeah.
then the positive symptoms are things that the disease brings, the disorder brings to my life, like the hallucinations and such, right?
Yeah. And the delusions. Yep.
So tell me about those delusions. What makes them so convincing and difficult for the patient to overcome?
It's, it's hard to really understand. It's almost as if I tried to convince you right now that you're not wearing glasses because you clearly are. Like it's not even possible to think that's not happening.
Hmm.
So to them, somehow this belief is 100% true, even if it's impossible. I've had clients think they're 900 years old. I've had clients think they're Jesus, and they absolutely believe it. And talking them out of it is not helpful.
Hmm. It's just not going to happen. Okay.
No, we work around that symptom. Like, that sounds stressful. Let's deal with your stress. I don't try to convince them otherwise.
Okay, good. So I understand onset is different in men and women. So fairly common, 1 in 100 or so people have some form of schizoaffective behaviors, and men more than women. And the symptoms seem to show up in men in late teens. What are those first symptoms going to be? What do I look for?
Well, it's a little difficult because the very early symptoms are often the symptoms of a teenager, like a lot of teenagers. Withdrawal, isolation, not trusting people. Well, you know what? There's a lot of 16 and 17-year-olds who do that, who don't end up with
Absolutely.
schizophrenia.
Right.
And then but then it starts to be the paranoid thinking and the not wanting to go to school and the shutting themselves up in their rooms all day, even more than normal teenagers, or difficulty with hygiene, which most teenagers, once they get an interest in, you know boys or other boys or girls or whatever,
Hmm.
they're starting to get into showering. But if someone's really struggling with hygiene, that's usually uh, something to do with mental health, or like being on street drugs or something.
So where does that come from? Yeah, you've talked to so many patients over the years. Why is hygiene a challenge?
When they're doing well, it's typically not a challenge. But when they're doing poorly, their brain is so preoccupied with these voices screaming at them and this terrifying belief that people are trying to kill them. Like, hygiene, if you go to a war zone, hygiene is low priority.
Yeah. Okay.
And these people are kind of in an internal war zone, and hygiene, like, if you're trying not to be murdered, you know, and the voices are screaming at you to do this, it's hard to be like, a shower sounds good right now.
Lisa, that's a powerful thought that I'm living in a war zone. In my mind, my brain, my existence, I'm living in an internal war zone. That's really disturbing. I feel sorry for these folks. What about women and their experience? Is it different than men?
I don't find the actual experience of schizophrenia to be different. Women do tend to get later than men. They
Hmm.
think there may be a protective aspect of estrogen, but um, I'm not sure about that. But they do get it later. The difference being some women have more time to develop social skills and independent living skills. If you're hit with schizophrenia when you're 15, there's a few years of not a lot of, like, emotional growth because you're so busy dealing with the illness. But if you're hit when you're 25, you've got extra time that you've learned more about being an adult and social relationships and that kind of thing.
I have read that medications can, as you just told us, make life fairly manageable, sometimes very
Hmm.
manageable. But there have been some very highly talented, highly skilled, highly intelligent people with well managed schizophrenia. I understand that. But I'm reading that finding the right combination of drugs is extremely difficult. Tell me what you've seen in that area.
It is difficult because we just recently have gotten, like, genetic testing has started to where you can get a genetic test done and they can tell you which medications your metabolism fits with. I don't understand the science of it well, but even that's not always covered by insurance. So in which case the psychiatrist just has to try them on a medication and see if it helps enough, if the side effects are tolerable. And often you have to go through 2 or 3 different medication rounds to figure out what's going to be the most helpful and the most tolerable.
And the side effects of these medications can be a real problem, correct? I mean, tell me what you've seen in that
Oh,
arena.
there's a lot of problems with, like, increased food cravings and weight gain and metabolic disorders like diabetes. The newer medications, researchers are looking for ones that don't have these side effects. There's also, fatigue and sleepiness. People will come to me saying, I fell asleep in my job again. If I do it again, I'm going to get fired. I'm like, you need to go see your psychiatrist to get a med adjustment. Sleeping is beyond what you or I would have if we had a bad night's sleep one night.
Yeah, it sounds just like a terrible disease. Tell me about the therapy that you offer, and what is that like? What are you working with on those? in those individual or group sessions?
Well, because I work in an outpatient clinic, most of my clients are taking their meds and are reasonably stable. Because if they stop taking their meds and become unstable, I send them to a higher level of care. So when they're reasonably stable, we talk a lot about noticing when your symptoms are happening and how to cope with them. However, in addition, people with schizophrenia have the same problems that you and I have. They have depression. They have relationship problems. They struggle with assertiveness. We go through all sorts of skills that they may have missed when they were ill, or, ideas that they, about relationships and dating that they may not know about. So it's a lot of skills building.
Yeah. Is the life expectancy the same for someone with schizophrenia? Am I going to have this disease for 50 years, 60 years if it comes on as a teenager?
The life expectancy is somewhat lower. I don't have the most recent research, but I believe it's not as low as it was before, because people used to smoke a lot more, people with schizophrenia,
Mm-hmm.
and fewer of them are smoking just because of the social pressure not to. But it's a shorter life expectancy in general. But I have clients in their 70s, so.
Paint me leave me with a positive outlook here. There has to be a smile in this somewhere. Where might that be?
Well, once a person gets stabilized and really committed to taking their meds and having a recovery environment, they're lovely people. They're creative. They're gentle souls. Unlike the stereotype, they don't like conflict. They're sweet. They've given me gifts. I can't accept gifts that cost money, but you can make me an artwork anytime. They support each other. It's just so different from the stereotype. That my support staff at the clinic has said that my clients are their favorite because they never scream at them if I have to cancel for whatever reason.
Huh. That is good to know. So
Hmm.
how has specializing in treating schizophrenia changed you?
That's a really good question. I have never thought about that. I guess I'm definitely a lot more compassionate about mental illness in general, and that you don't always have any sort of a choice, and that you just have to deal with what you are given. In the United States, a lot of upper class, especially white people, are used to throwing money and education at a problem to make it go away.
Hmm.
And that's not available for this disorder. Like, you can learn to manage, you can learn to cope, but you can't just decide it's going to go away.
Give me a tip or two if I'm in a scenario where I am confronted by someone who I think is having a psychotic break. Is there something I need to know about managing that situation?
Try to keep calm, keep your emotions down, because strong emotions are really overwhelming for a person with schizophrenia. If you ever feel in danger, you know, th- get the help that's needed. It's unlikely a person would be violent, but sometimes they don't know what's going on. Most of the time, it's just about seeing if you can get them the help that they need. Now, if this is a stranger, it's perfectly okay to walk away, call the non-emergency police line and say, this person is doing this. If it's a family member, then it's time to start looking into like psychiatrists, psychologists, and it's initially a very long road, but it can be very rewarding.
Yeah. How are law enforcement agencies and public service agencies doing with responding to those public health, mental health crises? Are we getting better at that?
Depends on where you are and depends on the specific law enforcement agent. Some of them are very understanding and will be like, oh, this dude needs to go to the hospital, not jail. Some of them are less understanding. So there's not a one clear answer to that.
Yeah, I keep reading that all too often hospitals are, excuse me, jails and confinement are the front line for mental health. And yeah, that is something we need to fix, isn't it? You
Yep.
offer a number of things on your website, which I'll include in the show notes. But what is it that you want people to find? Where can they go for help if they just have some general information, they just need some help? What do you recommend?
I would recommend they contact their local NAMI chapter. NAMI is National Alliance on Mental Illness. They have them in every state, and they should have local resources, because I know plenty of resources from Minnesota, but if someone emails me from Florida, I don't know what's down there. But
Okay.
NAMI has resources like that and should be able to point you in the right direction.
And that's nami.org, I believe. Is that correct? I think it is.
That's the national website. Yep.
Okay, good. So that'll be a good clearinghouse. Well, Dr. Lisa Cowley, thank you. I've enjoyed talking with you and learning more about schizophrenia. You've set me straight on a couple of things. I hope we did that with some others as well. Thank you.
Thank you. I enjoyed it.